There's a table in the report, and we followed up on each and every one of those. Having said that, if there are labs in countries that have samples, clinical leftover samples or blood samples or serology, it's worthwhile to have a look. But that needs to be done strategically, because what the evidence does tell us is that there was low level of circulation then. So you have to have the right methods to do so, which is why global collaboration is important. But I think Mariki will probably want to add.
Dr. Venter, would you like to add something?
Yeah, sorry. I think Maria covered most. Sorry, I'm frozen. No, sorry. Maria covered most of what I would like to say as well. So although we say no cases circulated earlier, it really means that it did not circulate at a high enough level that we detected it. The serology from Wuhan was all negative, according to them. We know that the case definition initially in Wuhan was very strict, and that mild cases would have been missed that way. And so individual cases that we've looked at that were traced back to the 1st of December, for example, were actually mild and initially not recorded, but they were hospitalized later on. So we think that the severe cases, were detected there. Probably lots of mild cases may have been missed, but we don't see active circulation at a high scale in countries outside of China or outside of Wuhan that's been reported to date. Of course, it needs to be followed up as all signs. Maybe we will find something in the future, but at this stage, there doesn't seem to have been widespread cases or circulation of SARS-CoV-2 outside of Wuhan before or early in 2019. Thank you.
Thanks again. Thanks again. So let's move to next question. Carmen Paun from Politico. Carmen, please go ahead.
Thank you so much, Tarek. I just wanted to understand a bit more about what the disagreements were regarding the report. As you've already discussed, there's a lot of speculation about the origin of COVID-19, and I believe that, whatever the disagreements were could also be easily be speculated one way or the other. So I was wondering if you could provide more information about, why the 3 people who wanted to be taken off the report, if there's some parts that they didn't agree with, if there's some sort of like minority opinion that they drafted to kind of explain their position on that. And if I may, real quick, I saw that the WHO published an announcement about anti-obesity medicines based on semaglutide and the risk of a eye condition. And I was wondering if anyone could address that and say how significant that is and how concerned people who have been taking these medicines or are taking them should be about this. Thank you.
Thanks, Carmen. I think for your second question, really best is to send us an email, and we will find the expert in-house who can answer that one. So let's go back to the first one on SAGO. Dr. Van Kerkhove.
Yeah, I'm going to start with that one because for our normal procedures for advisory groups, we consider the deliberations in each of the meetings strictly confidential. And that is on purpose, so that all of the members can have the discussions and the robust discussions that they want to have. Pretty sure you can imagine the kind of serious debates that would be done. When you look at the report, you will look at how rich it is in terms of all of the different content. You just look at the discourse in publications, you can see that there's many different views that people have. I think, frankly, the fact that, we cannot reach complete consensus is not necessarily a negative thing. This is showing that this is science, and science is incredibly hard. And especially when you don't have all information, the aim of SAGO was to have a fair, a factual, and an evidence-based report. To not be able to say exactly what happened, with the certainty that we would have liked, just shows how difficult it actually is after 3.5 years. But I do want to just say that the discussions, the deliberations are confidential amongst the SAGO members.
Thank you very much. And yes, again, Carmen, please send us an email on the other topic, and we will try to help. I think we have time for one more question. We have Laurent Sierra from a Swiss news agency. Laurent, please go ahead. Do we have Laurent Sierra from a Swiss news agency with us?
Can you hear me now?
Yes, Laurent, we can hear you now. Please go ahead.
Sorry. So now we have a pandemic accord, even if we have to negotiate the PAPs. So a question on what might change in the future and the future work of the next SEGO, if the name will remain. What do you think that historic agreement might change in the condition for the work in similar cases in the future? Maybe both Dr. Venter and Dr. Tedros. Thank you.
Thank you, Laurent. So the question is on pandemic treaty and then the SEGO, and what's the combination there? So, Dr. Van Kerkhove.
Yeah, thank you. So the work of this advisory group will continue. It will have new terms of reference. Like I've said before, they've finished their first term, and actually in the context of what we've asked them to do, that work is complete. The terms of reference are being revised. Now, remember, SEGO was not set up only for SARS-CoV-2. It was set up to develop this global framework, and it was for the study of the emergence of novel pathogens or re-emerging pathogens. There are many pathogens that re-emerge. There will be new pathogens that will emerge, and it's to apply that global context each time. SEGO produced a report related to Mpox and looking at the re-emergence of Mpox, made recommendations on what studies need to be done. We anticipate that SEGO will be utilized for this focus of looking at the emergence of any known pathogen in a new location, for example, or any novel pathogens going forward. This is really, the global framework is really the first time all of this information and what studies need to be done, from environmental studies all the way through looking at audits in laboratories, put together in one framework. Elements always existed, but they were separate. So what we want are member states to be able to utilize this global framework going forward, and we expect the new SEGO will be able to look at how did this framework work, was it well, should it be revised, and to make it better for the next time. But we also anticipate SEGO to be advising on other pathogens with epidemic and pandemic potential.
Thank you very much, Dr. Van Kerkhove, and this brings us to an end of today's press briefing. As we have said, so the SEGO report will be online shortly, and we will send to our global media list press release that will contain the link to the report. As always, the opening remarks of Tedros will be posted, and we will have audio and video file as well sent to you in the next couple of hours. With this, I will give the floor to Dr. Tedros for his closing remarks, and I would like to thank also Dr. Venter for being with us today.
Thank you, Tariq. As some of you may know, today is Dr. Mike Ryan's last press conference with WHO. And over the past 5.5 years in particular, since the COVID-19 pandemic began, Mike has provided an authoritative source of information for the world's media. So you know that, it's not a news to you. And I know that many of you value his experience, his knowledge, and his Irish way of saying things. WHO will not be the same without Mike, and neither will our press conferences. But when he says, I'm tired and I need to go, it's very difficult to keep him. Mike, my brother, my general, my friend, thank you from all of us for everything you have contributed to the health of the world's people and to keeping the world's media informed. Maybe I'll try to say it in Irish. Goraib Guvre Ma Agut. Is it correct? Gorev Mahagut means thank you, Mike. And we wish you every success, and you know that we will miss you, but we know also how to find you, so you cannot hide from us. But I would like also to invite you maybe to say Thank you to the media, to the press. But from me, thank you for joining us today, and really appreciate. And Mike, please.
Well, you caught me by surprise. It's rare that I'm speechless. So, no, I just thank you to all. It's been a long road, 8 years leading the emergencies program, and I can tell you it's a 24-hour, 365 job, and it's been a great honour, Tedros, to lead it on your behalf and on behalf of all of our wonderful staff and our partners, the people out there in the front lines, because we sit here in Geneva in the gilded cage, but those people who serve on the front lines of emergency response and the front line of public health intervention across all the agencies and across all the programs of the Ministries of Health, they're the real heroes of global health. And it's been an honour to serve them, an honour to serve you. The fourth estate is very important to me. You and the media are very important to me, and especially in a world that's so fragmented, your role is more important than ever, and I think the role of public health leadership is more important than ever. One needs to be courageous at times like this. It's easy to be brave when there's nothing at stake. It's hard to be courageous when everything's at stake, and I think we live in a world where a lot is at stake. Immunization is at stake, peace is at stake, health is at stake, honesty is at stake, the truth is at stake. So I think we have a common cause. We may bash up against each other from time to time. Your job is to keep us accountable on behalf of the people we serve. Our job is to enlighten you as to what the real issues are. And when I look around the table and see the people who are sitting here, especially you, Maria, who've enlightened the world, and Kate and Teresa and others, and many who've sat at this desk, it's been wonderful to watch people grow and people engage and do that. But just one point on what we said today. Someone did ask about, does this distract from WHO, SAGOs and all of that? The investigation of the origins and the investigation of what happened, the forensic understanding. We all do this in our lives. You know, we look back to see where did we make mistakes, where did it go wrong? And there's a huge positive aspect of that to help you move forward. And there's also a very negative aspect of that. If that's manipulated and if that's forced and that's done under pressure, it can cause dysfunction. So all of you out there, it's just in your normal lives, how much is enough? What we're looking for is improvement. If looking back and creating more tension, where we should move forward to create cooperation and participation and improvement, many a relationship was saved by the ability to what would you call it, managed obscurity, where complete truth doesn't necessarily benefit a relationship. And I think that is the case between our member states. We've moved progressively in cooperation in the IHR revision of 2005 and into the IHR amendments revision under Tedros, the Pandemic Accord. We're actually learning better ways to cooperate globally on epidemics and on emergencies. Tedros mentioned the Pandemic Accord and others, and he mentioned the Pandemic Fund and many other initiatives. So are we getting better at this? We are. Institutions like Gavi, institutions, the Medical Countermeasures Network, we're getting better. Are we perfect? No, we're not. We are getting better. But in this era of collapsed funding, of mistrust in public institutions, of the, in my view, the attacks that international UN and NGO organizations are under, this is not helping. But certainly we need to continue to look at origins and everything else. But if that's only been driven by political outcomes, if that's only been driven by the intent to hurt, if your intent to investigate is only to punish, you will never have justice. If your attempt to investigate is to be enlightened, then you will find justice through the process. And I think we continually have to find that balance in this. So yes, do we need to continue? Yes. Would I like to know what the origins of this virus are? Yes, because we want to be able to shut the door, close the trapdoor so that virus can never escape again. But there are many, many other viruses in the world. So that ability to be able to have the framework for investigating these. And it's not in the pandemic accord and it's not in the IHR amendments, but who knows? Maybe as time goes by in the next round of IHR amendments, the actual specific investigation of the origins will be enshrined in law. Right now, what we have is a framework. We have a framework that's been approved by our member states. That's enough to move forward. So with that, Tedros, thank you for your leadership, for your friendship. It's been a blast, to say the least. And your personal courage is always an inspiration to me. And this organisation could not be better led. Thank you.
Thank you again, Mike, and thank you also to members of the press for joining us today, and see you next time.